fatigue and brain fog are just some of the side effects people fighting COVID-19 are reporting. So why is this happening and what can you do about it?
KOLD fact finder Shaley spoke with a team of University of Arizona experts working to find the answers, and their research has already turned up new information.
We would have had
This kitchen is where Carmen Arena Arqueves Culmal makes her famous tamales and homemade soups.
my wife makes some of the best food I've ever had in my life.
But in November, Carmen could barely walk to the kitchen.
My body was weak, and I wasn't recognizing what was happening around me. I felt like I was dying.
She says she collapsed twice at home, losing consciousness.
I envisioned myself like a leaf being taken by the wind, and I didn't have a care for anything. I only wanted to be asleep, which is a bit strange because I'm a very worrisome person for everything. I like to have everything under control.
Her husband, Tracy, rushed her to the hospital where she spent 6 days recovering from COVID-19.
Sometimes acted like she didn't want to live anymore, so. But I told her she wasn't going to leave me.
Dr. Meredith Hay is a professor of physiology at the University of Arizona College of Medicine. She is working with a team of researchers to find out why so many diagnosed with COVID-19, like Carmen, suffer from brain fog and fatigue.
We started our study very simply by asking a question. Those patients who are in the ICU are really hard to hit. Is there evidence of neuroaxonal damage?
Hay says they can measure a protein that comes from the blood in your brain and predict if you will have cognitive impairment. Dr. Sairam Parthasarathi is a professor of medicine at the University of Arizona who is working with Hay on this research.
We think that their brain barrier function may be lost and there's inflammation that's going into the brain. And the inflammation in the brain causes us to be fatigued, the nerve cells don't function right.
Is this something where it's like, okay, maybe I have this inflammation and I should seek treatment, or is it something that you just kind of wait it out?
See, that's what we don't know the answer to that.
Parthasarathi says what they can do is treat the symptoms. So if you're having a hard time feeling rested, see if there's anything else going on that could be treated, like sleep apnea.
Having sleep apnea increases the risk for developing COVID disease. And so there's a correlation with that. That means people who survive COVID are more likely to have sleep apnea, for example. And so we can actually treat them and make them feel better.
Carmen still suffers from lingering side effects, but she recently received her COVID-19 vaccine and is starting to get back to the things she loves most.
She has to be on the go, on the go, on the go. I tell her to slow down a little bit, but you know, it's like, so she's better.
This team at the University of Arizona is researching how to treat and prevent these COVID-19 side effects. They have created a website where people can register to volunteer cognitive health information so the experts can research the long-term effects of COVID-19. We have information on how you can get involved on KOLD.com. For the fact finder, Shaley Sanders, KOLD News 13.
Thank you, Shaley. A Wilcox man is behind bars after holding nearly a dozen